client who is recently, like in the hospital, recently hospitalized, stepping down from a hospitalization would be a really, really good candidate for the Malibu program. We're also a really good fit for, say, a client is decompensating in a PHP or an IOP setting and they're struggling, and that setting is thinking that they're needing higher level of care for short term, but maybe not meeting criteria for hospitalization. But that would be the right type of candidate. Really quick, I'm going to go over just my kind of philosophy or approach with Continuum of Care, and then talk about where Malibu falls. That will inform a lot of the interventions and services that we're offering. If you think of Maslow's hierarchy of needs, that as you start to develop some of the foundational things, you can move into higher levels. And that's how I think about treatments with levels of care. So when we're down here with RTC, it's very foundational and elementary. This is residential, especially at a CRTP, is meant to be focused on stabilization and safety. So a lot of what we're looking at is, active coping. In some clients, it's moving them from a pre-contemplative to more of a preparation stage, looking at some of the relational or systemic issues that we can identify that need to be worked on. Also looking at any ADL needs, basic needs, again, psychoeducation, a lot of resourcing, medication management, motivational interviewing, case management, helping people with emotion regulation, distress tolerance, nonviolent communication. So really focus on stabilization. So treatment at this acute kind of CRTP level won't be as kind of higher level as you might see in like an IOP or an outpatient. We're not going to be doing in-depth trauma work. We probably will be identifying trauma. We may start resourcing, but we're not going to be getting into a lot of the deep insight-oriented, more kind of meaning-making type of therapy. This is really going to be focused on, again, stabilization, safety, psychoeducation, medication management, grounding. This is sort of what's appropriate to do at that level.